The immune system has been put on notice. Do your job, not only when a virus invades the body, not only when an infection spikes a fever, but when cancer shows itself. Step up, attack, and aggressively destroy this invader.
We now absolutely have proof of the principle.
That's what Jonathan Powell, professor of oncology and pharmacology, is doing at the Bloomberg Kimmel Institute for Cancer Immunotherapy at the Kimmel Cancer Center at Johns Hopkins.
What's really neat about immunotherapy is immunotherapy has the capability to kill all cancers, right? Now, we still have to figure out the right combination, but the beauty of this whole system is that immunotherapy can be used for breast cancer, for colon cancer, for lung cancer. The key is to just find out how that particular cancer is evading the immune system or turning off the endogenous immune response. But the most important thing is that the recent breakthroughs in immunotherapy show us that unequivocally this works in people. We can unleash the body's own immune system to get rid of cancer cells. And that, I think, is actually underestimated, even with all the hype that's been going on with immunotherapy. And to me, that's the beginning. So one of the dilemmas in immunotherapy is that we know that the immune system can recognize tumor cells. And if that's the case, then you might ask, well, how come your immune system doesn't get rid of tumor cells all the time? And the reason is, to be quite honest, is that tumors are very clever, right? So what they do is they put up these molecules that turn off your immune system, right? They turn off the cells that are designed to kill the tumor. So that's pretty clever on the tumor's part. What we're doing is we're blocking the inhibitor molecules on the surface of the tumors. We're blocking their ability to turn off the immune system. We found the kink in the armor, right? The more we can block these inhibitory pathways, then the percentage of patients that are going to be cured by immunotherapy is just going to get greater and greater. And so now it's just our job to figure out all the different combinations to make it work in more people. We now absolutely have proof of the principle that in your body and my body, our immune systems, without any manipulation, have the capability to generate cells that kill tumors in the same way that we generate cells that kill infections, like when we get a viral infection. This is just the beginning, right? Because all the success we have now is just going to get greater as we try new approaches, new therapies in immunotherapy. We always test the new treatments on patients that have failed the old treatments, and that's where we're at now. But what's going to be really exciting is when people get treated right away with immunotherapy as it proves its mettle, people are going to start to get treated up front with immunotherapy. And then what we're going to see is this whole new field is not going to be this like extra side field, but we envision it's going to really take over the way we treat patients. Any patient that has the opportunity to be in a trial with immunotherapy should really seriously consider participating, because this new approach is such that a lot of the side effects that you would get from just getting chemotherapy are not there. That's number one. But what's really neat is that just because you fail with chemotherapy, it doesn't bode ill that you're not going to respond to immunotherapy, because it's a completely different mechanism. So in a sense, you're saying, okay, your tumor was able to outwit the initial treatment, but now we're going to come back with something that's completely different that maybe the tumor didn't even think of, and as a result, I think there's reason to believe that the trial would be successful. If a patient was kind of downtrodden because they had undergone a lot of chemotherapy and experienced a lot of the side effects, when you switch to immunotherapy, you'll find that it's not the same thing. It's not like same old, same old. The side effects are very different, and as a result, I think a lot more tolerable.